Oral questions. I recognize the Leader of the Opposition.
Savannah Gunderson lives in Sunset Extended Care. Her husband, Don, is here today because the quality of care for his wife and for the other residents is not even close to acceptable. He doesn't blame the frontline workers, Mr. Speaker, because they're run off their feet. Rather, Don blames this government for scrapping minimum care standards and for failing to fix the basics when it comes to seniors' care. Don and Savannah deserve better, and Saskatchewan people deserve better. So this government has untold millions of dollars to pour into its Lean Pet project, Mr. Speaker, while they forget and they fail on the basics, Mr. Speaker, while Saskatchewan people in care suffer. My question to the Premier, what will it take for him to recognize that minimum care standards and appropriate staffing levels are required for better care in Saskatchewan?
Mr. Speaker, the Minister has tried to claim that her 4-day layover in London was filler between her time in Ghana and another conference in Prince Edward Island. But the conference in Prince Edward Island started 10 days after the conference in Ghana ended. The Minister could have come home and worked for a week before going to Prince Edward Island. Instead, she tacked on extra days in Ghana and claimed all her per diems, and then she hung out in London with her friend and sent the bill to the taxpayers. To the Minister, why didn't she either take those 10 days off and pay all the expenses herself, or just come home and work for a week instead of racking up bills for the taxpayers?
Yesterday we learned a bit more what the Minister of Social Services meant when she said she was just doing what everybody did. 5 minutes before the legislative proceedings began, we learned the taxpayers also paid for a completely unnecessary limo service for the Deputy Premier while he was in London, England, shortly after the Minister of Social Services was also there. The Premier and the Deputy Premier both said the Cabinet Secretary claimed this expense. But, Mr. Speaker, that's not true. My question to the Premier, why did he say that, and what's the truth? It's unbelievable to see him defend the sense of entitlement with his members. The Minister of Social Services went to Ghana, billed $19,000 for a conference, Mr. Speaker, that she applied to go to. She created this trip, Mr. Speaker. And until yesterday, she completely withheld the fact that she had a friend and a family member along with her for the entire time. And, Mr. Speaker, taxpayers actually paid for the visas for her friend and for her family member. Yet, this Premier thinks the Minister of Social Services is doing nothing wrong. My question to the Premier, how can he possibly justify a $19,000 expense for the Minister to go on a vacation with her friend and family member, Mr. Speaker? Why would he demand accountability from his Minister? This Premier is forgetting that he is in charge. This Premier is forgetting that he needs to answer the questions. This Premier, Mr. Speaker, is bending over backwards to defend his Deputy Premier, to defend his Minister of Social Services, and this pathetic display, Mr. Speaker, to try to deflect from the issue is not what Saskatchewan taxpayers deserve, and he knows it, Mr. Speaker. What the Premier is saying, Mr. Speaker, is that he knew his right-hand advisor had labeled the personal expense as a work expense and billed it to taxpayers. But the Premier claimed that it was just a clerical error. This was a $200 personal meal, which was designated as an official debrief meeting and billed to Saskatchewan taxpayers. And, Mr. Speaker, they only paid it back once they were caught. My question to the Premier, how does this not qualify as expense fraud, and why is he not taking this issue seriously? Mr. Speaker, the Deputy Premier hopped into the limo service in London. He knew what he was getting into. The Minister of Social Services hunts down a conference in Ghana, arranges a family and a friend to go along, Mr. Speaker, and bills $19,000 to the taxpayer. When will he stop making excuses? When will he act like the Premier? When will he hold his Deputy Premier, his Minister of Social Services, his official to account?
But your record with the teaching professionals across this province, your record with students, has been miserable. Your respect for the hardworking professionals in this province has been pathetic. We can go back to what can be framed by many as attack ads in the last round of bargaining, to pretending that somehow you've resourced classrooms, when the reality of today's classrooms is something entirely different. But the students of this province, the teachers of this province, the boards of this province deserve something better than that.
We hope that we can see, particularly when we have 12,000 kids on social assistance, and that number is not changing and hasn't really changed. That's that's something that should be of concern. Should be of concern and should be of urgency. 7 long years, and your officials can hand you all the data that they want. 7 long years, and I take a look at this, and you can throw out the 100 million, and you can do your canned speech, all you want to do, Minister, and eat up the clock, but I am not hearing, and is it going to be another 7 long years before you increase the adult basic allowance? And the big picture really would be a poverty elimination or a poverty reduction strategy. And I think this government really should be taking a look at this.
1 year ago today, Carrie Clausen came to the legislature with significant concerns about seniors' care. Carrie's mom was in the Sunset facility, and at the time, she had written to the health minister about her concerns. His dismissive response was not acceptable to her. So she came to the legislature, Mr. Speaker, and helped put seniors' care on the public agenda in a very big way. Carrie's concerns included, Mr. Speaker, residents falling, being left unattended on toilets for hours, calls for help going largely unresponded to, and seniors not even receiving regular baths. Well, Mr. Speaker, Carrie is back here today, 1 year later, because seniors' care hasn't improved in Saskatchewan. And Carrie is not alone, Mr. Speaker. Lynn Seaborn is back here today as well. She came to the legislature last May with concerns about her husband Adrian's care. Carrie and Lynn are frustrated because they've seen so little real action from this government, a fair bit of talk, but not much action. Don Gunderson joined us earlier on this week because he had concerns about his wife's care here in Regina. And to the minister's credit, he met with Don yesterday. But Don was not satisfied, Mr. Speaker, with what the minister had to say. Like Carrie and Lynn, Don wants this government to stop making excuses and to reestablish minimum care standards. Right. What's especially frustrating for people like Carrie, like Lynn, and like Don, Mr. Speaker, is that this government is more focused on its shiny pet projects as opposed to actually fixing the basics in seniors' care. Right. $14 million going to one U.S. consultant, $17 million last year for Kaizen promotion offices, $3,500 a day, Mr. Speaker, for Japanese senseis, and untold millions for healthcare workers to take training, Mr. Speaker, where they learn Japanese words and where they learn how to fold paper airplanes. This is where the priorities lie with members opposite, as opposed to actually fixing the basics. Right. My question to the Premier, when will his government admit that there's a crisis, focus on the basics, and take real action as opposed to being focused on their shiny lean pet projects?
Slashing programs such as the Go Green Fund and the Inner Guide for Houses Energy Efficiency Program set the province on a backward course, and we know that since 2009 the government of Saskatchewan has reduced climate change funding by 83%, including another 35% cut in the most recent budget.
Mr. Speaker, this government keeps ignoring northern roads. 2 days ago, students and staff from Cumberland House School were on Highway 123 and they were stuck because, according to the vice principal, and I quote, "The road was in horrid condition. It's about 18 inches of mud," end quote. My colleague, the member from Cumberland, has stood in this assembly repeatedly to demand that this government properly repair and maintain Highway 123 to Cumberland House. But this government has failed to get the job done.
Based on the government's own data, Dr. Mark Lemstra says it is, quote, "wrong to publicly state that lean has had a positive impact when their own data indicates the opposite," end quote. The government says they don't agree with Dr. Mark Lemstra, but Dr. Mark Lemstra is using the data and the figures from government. This government data, it shows that adverse events are up, overall satisfaction of patients is down, the number of patients satisfied with their pain management is down, the mortality rate for major surgery is up, and the rate of infections, Mr. Speaker, has also jumped. 2/3 of nurses are saying that patient safety is getting worse in hospitals and care facilities throughout Saskatchewan. So the data shows it, and what we hear from nurses, Mr. Speaker, it's also backed up. But the Premier is continually dismissing this, and he won't even admit whether or not the government's own statistics are correct. He doesn't want nurses to be able to speak out about patient safety, Mr. Speaker, because his government is more concerned with promoting their lean pet project. They have $40 million, Mr. Speaker, $40 million for one U.S. consultant, $3,500 a day per sensei to fly them into Saskatchewan, Mr. Speaker. They have $17 million last year alone for Kaizen promotion offices, and untold millions to force training on healthcare workers where they learn Japanese words and learn how to fold paper airplanes. My question to the Premier, and I hope he gets up and answers this, when will he admit that patient safety is being harmed? When will he admit that they've lost their way with lean?
Speaker, the Premier's lean project isn't just confined to healthcare. We've learned that it's taking over education as well. Educators, parents, and students are concerned about that because they've heard and witnessed about the impact of lean in its deployment on our healthcare system. To the Minister, why is this government pouring so much money into the Premier's lean pet project while ignoring the basics that matter in classrooms across Saskatchewan? I guess the Minister can say whatever he wants, all the rhetoric in the world, pretend what he likes. But, I think the students that are here and the teachers of this province know the reality. That Minister has been forcing reviews of lean across education, but it's apparent he didn't factor in a few important things, like the cost of demoralizing the teaching professionals of this province, or the cost of under-resourcing the classrooms, the cost of not providing the needed support for learning, essentially the cost of shortchanging the students of today. And that seems like a whole lot of Buddha to me, Mr. Speaker. Wasted opportunity. The apparent lean Kaizen model might be a good fit for some businesses, but we're talking about education, and that certainly brings some different challenges. And it's this project seems to distract from what matters. And unlike cars off a production line, we can't recall students 5 or 10 years down the road. We have one chance to get it right. To the Minister, when will he get it right for the students today and stop ignoring the basics that matter in our classrooms?
We learned 3 weeks ago that the home care program in the Regina-Capel Health Region is stretched so thin it is not able to meet the needs of new clients, and it's cutting services for existing clients. The Premier, the Health Minister, and the Rural Health Minister were all caught off guard, and they were unaware of the major capacity challenges in the home care program here in our capital city. Hopefully, that was a wake-up call for them, and they are now paying more attention to this vital service. We hear about people having their existing services cut back significantly, and we hear about people having to wait far too long to access services. To the Minister, how many people have had their vital home care services cut back, and how many people are waiting to access home care services now?
We know about 2 significant expense problems with the current ministers. Both occurred in just 1 month last June. And the Premier wants us to believe, Mr. Speaker, that he's reviewed the last 7 years of his minister's expenses and there's nothing else to see. He wants us to believe that the only problems that occurred were 2 incidences back in June. Well, Saskatchewan people, Mr. Speaker, have a tough time believing that. So to the Premier, will he commit to an independent review today?